18 kilogram in body weight. She was asymptomatic and referred to our clinic for evaluation of systolic murmur. On physical examination, 2 out of 6 systolic ejection murmur was noticed at upper left sternal border, and the fixed splitting of the second heart sound was present. ECG shows sinus rhythm with first degree AV block. Transthoracic echocardiography revealed a defect on septum secundum with left to right shunt. The diameter of the defect is 14.6 millimeter on 2D, and on color flow it was 18.2 millimeter. Right ventricle was enlarged. Total septal length was 34 millimeter, and the IVC rim was floppy. These are transthoracic images. Our intended intervention is transcatheter closure of this defect.
We see Flora.
Right.
Okay. Now we are trying to close the ASD. Azıcık sağdan gel Birgül abi. Azıcık rotasyon.
Who is doing this case? Could you please introduce yourself, your team, and here in the
Dr.
panel.
Birgül Varan is the operator of the patients. Now,
We couldn't hear you. Would you please repeat it?
Dr. Birgül Varan from Başkent University.
Yes.
Hi, good morning everybody.
Okay, good morning. Can you tell us what kind of device, the size, etc.? Did
Okay.
you do the balloon sizing, or what's your assessment before implanting a device?
We are trying to close an ASD which is an ellipsoid one.
We cannot hear your
Okay,
voice.
is it okay now?
Would you please make an arrangement in your microphone?
Increase the volume, probably.
Abdullah gel.
I think you may need
Tevfik,
increase
is
your
that okay?
volume.
Tevfik, can you hear now?
It's not good still.
Can you hear now?
Yeah, it's okay now. Okay.
Okay, it's an ellipsoid ASD with the smallest diameter is about 10 to 12 and the largest one is 16. We did a balloon sizing and we measured almost 18 millimeters at the largest size. And the most prominent property is the floppy IVC rim. And we can show you the echo now. Alper,
Please echo.
can you show the echo?
We see the echoes in small picture. Could you please? Okay.
This is in 4-chamber view.
Yes.
There are good rims here, and ASD is about 11 millimeters.
Change.
The largest defect is in the bicable view, and it's about 15.5 millimeters with a floppy IVC rim. It's an oval ellipsoid shape ASD in 3D. It's 10 to 14.1. So we did a balloon sizing, and we can show the
Balloon sizing. Echo view.
Actually, we would like to see the 2D images of the ASDs and rims first, because to this, I mean, maybe we can raise a question here. In such cases, do we need a balloon sizing really, or I don't know. What do you think?
Yeah, can you make a comment about the technique you're using for balloon sizing? You want to see the indentation of the balloon, you use the so-called stop flow technique, or
Okay.
what else?
It's a
You
stuff.
first see the four-chamber view. It's a good centering ASD. Bir aorta pozisyonu gösterir misin? Tamam.
Anladım şimdi.
You see the color flow and again in four-chamber.
Yeah, we saw the echo pictures very
Uh,
nicely.
Tevfik
We
insisted
use
on
for
seeing.
the
This is-
stop flow technique.
When doing the balloon sizing, can you show us the balloon on fluoroscopy? Or did you record this?
Yeah, we did record.
yeah.
Flora'yı gösterir misiniz? Can you see now?
Well, roughly, we see the cath lab and now we see the balloon. Yeah.
It's about 17.8.
Stop flow technique.
It's in the stop flow.
The stop flow. Any comments or questions for the audience to this measurements,
Echo
etc.?
views 15 or 16. Öyle değil mi? Sizing thing.
In stop flow, echo showed 15 to 16 millimeters of balloon in indentation.
I mean, as far as I can see from here, from the echo pictures, the rims looks fine. I mean, in such cases, if I'm sure about the rims, that they are good, and the
Şimdi
diameter
ekoya
of the
dönüp şeyi
ASD,
gösterebilir
then
miyiz? Balon sizing.
usually I don't do balloon sizing, and I decide to close ASD with the color Doppler imaging
Yeah.
ASD diameter or 2D imaging
We,
ASD diameter.
So what
Tevfik,
size would you use, Tevfik?
If the biggest diameter of the ASD with color Doppler in such cases, let's say 16 millimeter, then I usually use 16 or
IVC
18
rim is very
millimeter,
very floppy.
Tevfik, we
1 or 2
first
millimeter bigger device.
we firstly thought
But if you look at the balloon sizing, it looks bigger than that measurements. That's why.
They
So,
took 18
Mario?
millimeters.
Mario?
Yes, that's a question from Shakuresh. Yes.
Well, it's a comment really, and that is similar to what Tawfiq has just said. If you've got a defect without balloon sizing of 15 and floppy rims, then it's safer to add a couple of millimeters just to slightly oversize. So you'd finish up with 17 or 18 millimeter device here.
Sol atriuma
And that's
girdiyse
what needs to
size
be
söyleyin
implanted.
Which is
çocuklar.
more or less the same that
dört boş yanlış.
the size you're going to choose after balloon sizing.
İyi gözüküyor.
Çok yumuşak.
I would also suggest
Soldayız.
in
tamam.
such a case
Şeyde,
to go with
Birgül
the
abla,
color
birazcık
Doppler
sağdan
and not balloon
gelirsen
sizing.
septuma dik
But
geliyor.
of course, many people do differently.
Azıcık
Like
sağ- azıcık
yesterday,
sağa
we had a
rotate.
case. I would have
Öyle
done
gel.
also the balloon
Birazcık
sizing
da
with
diski daha
multiple
çok at.
ASDs.
Disk tam
It does
açılmadı
help
abla.
in decision making occasions.
Yeah,
Biraz,
I agree.
Tamam.
There are
Ha,
occasions
şimdi
where
rotate
balloon
et.
sizes is more helpful, and in some other occasions
Şimdi gel.
when you see the difference very nicely with very definite.
So in
rims,
this case, the
probably
device keeps prolapsing.
doesn't
Tamam,
add
o zaman
any
açıldığı
significant
pozisyonda
information.
gelelim.
Yeah.
So in this case, the device keeps prolapsing because it is coming at an angle. So I think they've had two attempts. I would start now in the right upper pulmonary vein because otherwise, the more you keep pulling, there is a possibility of enlarging
Well,
the
Shak,
defect.
that's a question we were to ask to the operators. Yes. What are they going to do? Can you comment on
It's
yeah,
good.
or what you're doing and what technique
Yeah.
It's
you're
good.
going to use?
It's good.
The device dropped to right atrium, so we are trying once again.
Aç sağda aç. Tamam.
No, it's perpendicular.
Yes, clearly, it's clearly prolapsing through the defect. Yes. So Shakureshi was suggesting
Right
some
Right pulmonary
tricks
vein
to
technique.
overcome this problem. What technique are you going to use to avoid prolapsing?
We may use right pulmonary vein.
Yeah.
After
Right
trying-
pulmonary vein deployment is going to be the first trick you're going to use, correct?
Yes.
Yeah, we
Mario?
will use that.
Yes.
Maybe
Omar.
we may
Some-
try once more.
I think right pulmonary vein is excellent. Sometimes it helps, but sometimes you cannot get the sheath there. So a way would be to deploy a little bit of the disc in the LA and then rotate slightly clockwise. Then you can get also sometimes in position.
Did you hear what Dr. Kalal said?
No, excuse me, once more, please.
Well, Dr. Galant said sometimes if you want to attend the right upper pulmonary vein deployment, it's okay, but it's going to be difficult to reach the pulmonary vein with the sheath.
Yeah, sure.
So we're suggesting is just to deploy partially and rotating
Okay.
and manipulating a bit.
Sen sağ pulmoner ven tekniği bir yap bakalım.
Hayır, onu buradan yapmak zor. Kateterle denemek lazım.
Which size are they
Ben
using?
şöyle tutayım, sen dene o
Ben
zaman.
bir deneyeyim.
What?
Device diameter, what?
What's the size of the device you're using?
Tamam.
Okay.
It's okay.
Oturdu hocam, oturdu.
It's 17 millimeters. Hyperion.
17 millimeters. 17 Amplatzer device or
No,
what?
it's Hyperion.
It's
I
the similar device like the Platzer.
Okay.
It's almost similar. No.
So
difference.
you managed to place the device
Kemal-
properly. How did you do? Can you explain us?
While we rotated the sheet towards the right pulmonary vein, Kemal deployed the device.
Rapidly technique with the right pulmonary vein technique. Only rotation the right side, the long sheet, then pull it quickly.
Can I add something very small? Please don't, now it's correct, because you are pulling too much at the device. I would push it slightly.
Okay, we
because
pushed.
still it can dislodge.
Is that okay? We pushed. Tamam.
The better thing.
Şimdi şu IV'sini kullanıp bakalım.
Well, that is going to be a nice test for stability. Push and pull and see what's going
Can
on.
we see the color Doppler images of the
Yes,
devices?
the echo.
Vitrele çok mu değiyor? Would you comment on the size? Is that okay for you, for this defect?
We would like to see other positions also.
Now Alper is checking for the rims and he's showing you the other positions.
The device has attention yet. The cable is not so soft.
We can ask the audience, would you release the devices at this point?
Yeah. It just, unless the operators are comfortable, it just looks as if it might be slightly undersized on some views on the TOE.
Why are you saying so?
Well, on one of the views, it looked as if there was a edge of the disc, left atrial disc, was very close to the rim. So either you release it and see, and it takes a better configuration, or if you want to have it straddling the aorta, then yeah, on that view.
Birazcık gitti.
Gittim.
Heh, bak şimdi daha iyi.
Alalım. Aldım onu. Epeyce aldım. Epeyce aldım.
Mario?
Bence iyi
Yes.
ya. Salınınca daha iyi olacak.
Phoenix.
If you argue whether this is a problem, a critical part of the procedure, whether there is a risk of any prolapse after releasing, the color flow helps very much. If there is a significant flow at that part, it may be true that is too small, but otherwise is there no residual flow, then the configuration of the device will achieve a better position there.
I would like to add one more thing, Mario, if I may. That usually when you have one of the rims, which is very thick septum, you're mostly confident that it will hold for the rest of the missing rims or something like this. In this case, we don't have any rim which is really stronger than the others.
So eventually, what do you suggest?
No, I think release will be fine.
Everyone is happy here and waiting for releasing the device.
Dört boşu göstereyim. Thank you.
Would you do a pull and push
Şöyle
maneuver
biraz yakınlar.
before releasing?
Ask.
Would you do a pull and push maneuver without
Yes.
before releasing?
Yok,
Bence
tamam.
iyi. Çok push and pull azıcık dokun.
We can just slide. Pull and push.
Çok push and pull yapmaya uygun bir septum değil bu. Geri verir.
Evet. Ha, IVC rimi iyi değil mi? Ben en çok
Oradan
ondan
fırt
korkuyorum.
diye
Çok
fırtlar
kaçtı
ya.
çünkü.
İVC içeride. Bence çok ön pull and push yapmadan bunu
Bırakalım. We are releasing it.
Okay. Can we see the fluoro also?
Okay. Fluoro'yu gösteriyor muyuz?
Should we see the fluoro?
Fluoro and echo, please.
Well, if I make an additional comment when you're not sure about, well, that's okay. They are releasing the device.
Okay. Tıp onu da atriumdan dışarı. Çek şimdi.
Alırım.
Yeah. What I usually find helpful to
Echo,
test the
echo,
stability.
echo bigger, please.
Yeah,
Eko'yu.
Echo bigger.
it looks very nice. What I find useful in the daily practice when you want to test the stability, if you pull the device on the LAO cranial projection, you will see the two discs separated from each other, and that is going to be the most reliable
Biraz, little
sign
bit,
of stability of
stiff.
the device, in my
Hard.
opinion.
And
What
the
do you think?
cable is
Any
very
other comments
sticky.
on that? Well, Jacques, Felix, and Omar were chatting and didn't hear what I said. Oh, yeah.
Şeyde.
Well, you certainly agree with
Şey ama
about what I said.
kablosu da sert biraz bunun.
Yes.
Ben ilk defa denedim ama.
Any other comments from the cath lab? You're
Aslında
happy?
sağı açtırıp
The device looks very, very nice on the septum.
Okay, it looks nice in the echo. Thank you.